There are 125 trivia, including images, labeling, true, false, and multiple choice questions. Information credit to requiz.com, remaster.com, Quizlet, Google, and Wikipedia. Ready? Let's start. See if you know this one. Where is the cuboid bone? Forearm, wrist, hand, calf, foot, or ankle? The answer is E, foot, as you can see in the images. Now, let's try to learn some anatomy parts that are pertain to the MRI board exam. Try to label these. I will reveal the answers for each one. A is acetabulum. B is labrum. C is the femoral neck. D is the obturator externus. D is the adductor muscles. F is the vatus lateralis. Note, the adductors are under the obturator, and vatus lateralis is at the outer edge. Lateral. G is femur. H is the greater trochanter. It's a big hook-like. Big equals great. J is the femoral head. K is the body of ilium. And L is iliac crest. Because we use the iliac crest a lot in clinical practice, do you remember what level of the lumbar? The iliac crest is at L3, L4. You will use it as the reference to position your patient correctly when you do the lumbar scan. Do you know what sequence or type of image this is? This is a T1 weighted image of the bilateral hips, in the coronal plane, using the metal artifact reduction technique. What about this image? This is the T2 stir of the bilateral hip, in the coronal plane, with a metal artifact suppression technique. As you might remember that, the stir technique uses an alternative MRI sequence that suppresses signals from fat and the additive effects of T1 and T2 mechanisms on tissue brightening. This is why the fat in T2 stir is dark and not as bright as in T1. Can you guess what type of image is this? This is T1 weighted image in coronal plane. You know this one for sure, right? T2 weighted, coronal plane, proximal thighs for mass, lipoma, signal intensity matches fat on all sequences. T1 is good for the anatomy, but T2 is great for pathology. Do you know what body area is this? It's the knee. Now, let's learn the anatomy of the knee. A is the medial femoral condyle. B is the medial collateral ligament. C is the medial meniscus. D. Tibial plateau. E is the lateral meniscus. And F is the lateral collateral ligament. The collateral ligaments in the knee would be best visualized with the what slice orientation: coronal, sagittal, axial, or oblique. The answer is acoronal, as you can see in the previous image. To evaluate for anterior cruciate ligament, ACL, tear, positioning the knee would require what degree of external rotation? 5 degrees, 10 degrees, 15 degrees, or 25? The answer is 15 degree, external rotation. Very important for the board exam. What kind of image and what structure is the green arrow? It's a proton density fat suppressed sagittal, left, and T2 weighted sagittal, right, indicating meniscal flounce, green arrows. What about this image and what structure? T2 sagittal oblique knee, torn ACL, anterior cruciate ligament, as you can see in green arrows. Can you identify this one? This is the proton density sagittal, a tear of the posterior horn medial meniscus, in the blue arrows. Compare this to the previous image, Can you tell the difference? It is also a proton density coronal, but with fat suppression indicating the tier posterior horn medial meniscus in blue arrows. Now, let's learn some more knee anatomy in a different view. A is patella. B is the femur. C. Anterior horn of lateral meniscus. D. The tibia. E is head of the fibula. And F is the posterior horn of lateral meniscus. This is the image taken using proton density weighted, sagittal, with fat suppression left knee. Let's do some more of the knee. Any of these structures is a fair game in the board exam. Hang in there. A is quadriceps tendon. B is easy. Patella. C is patella tendon. Noted that the tendons here in this image are black. F is the distal femur. E, posterior cruciate ligament. And D is tibia. So now, can you tell what's in the yellow arrows in this view? The yellow arrows point to the fibula fracture in different views. You must know this one, purple arrows, right? If you say, proximal tibia fracture, you are absolutely correct. So, which bone is bigger, tibia or fibula? Tibia and fibula are the two long bones located in the lower leg. The tibia is a larger bone on the inside, and the fibula is a smaller bone on the outside. The tibia is much thicker than the fibula. It is the main weight-bearing bone of the two. Sorry that we have to learn anatomy in the MRI images. I know, it's a pain. A is the right femur. B is the patella. C. Vastus medialis muscle. D. Sartorius muscle, which is the longest muscle in the human body. E is the medial condyle. F is the medial head of the gastrocnemius muscle. Adjacent to it, G, the lateral head of the gastrocnemius muscle. H is posterior cruciate ligament. J is medial epicondyle. Don't mistaken this with E, medial condyle. K, medial retinaculum. L is lateral epicondyle. M, anterior cruciate ligament, ACL. N is lateral patellar retinaculum. O, intercondylar fossa. And P, articular cartilage. Did your head spin yet? This is proton density weighted, in transfer, axial plane, with fat suppression of the right knee. Now that you got some oxygen to your brain, do you know which structure in the body is the tendinous extension of two muscles in the lower leg, gastrocnemius and soleus? That is the Achilles tendon. What is the strongest tendon in the body? A. Supraspinatus tendon. B. Achilles tendon. C. Peroneal tendon. D. Quadriceps tendon. E. Patella tendon. The answer is B. Achilles tendon. It's also the thickest and strongest tendon. Now, let's learn the anatomy of the ankle and foot. This image is not too bad. A is Achilles tendon. You just learned from the question. This is how it looks like in the MRI image. B is calcaneus. C. Talus. D. Tibia. What slice plane is the optimal scan orientation for visualization of the Achilles tendon? Coronal, sagittal, or axial? Sagittal. This is A. T2 sagittal stir ankle, Achilles tendon tear, orange arrows, confirmed via T2 hyperintense or bright signal, within normally black Achilles tendon. Can you tell me what's in the orange arrow? You are right. Achilles tendon. This is a T1 weighted, axial of the ankle, Achilles tendon tear. This one is A. T1 sagittal ankle, Achilles tendon tear. Let's do a little bit of the lower extremities vascular. A and B are the right and left popliteal arteries. C and D are the right and left anterior tibial arteries. E and F are the right and left fibular arteries. Finally, G and H are the right and left posterior tibial arteries. Sorry, I lied. Just a few more. Can you name A, B, and C on this picture? A is the abdominal aorta. B, left common iliac artery. C is left internal iliac artery. Can you guess what D is? D is left lateral circumflex artery. What about G and H? G is dorsalis artery. H, right plantar artery. Last one in this image, I promise. What is M? M is external iliac artery. Done with vascular. Almost done. Just a few more. These are very high yield in the board exam. This is why I am torturing you, for your benefit. A is intermediate cuneiform. B is lateral cuneiform. C is cuboid. Remember, this is the first question in this video? You are welcome. D, peroneus longus tendon. This big structure, E, is calcaneus. Here we go again, F, Achilles tendon. Now this will most likely be on the exam, right? G, medial cuneiform. This is A, proton density weighted, transverse axial with fat suppression of the left ankle. True or false? The Achilles tendon is also known as the calcaneal tendon. True. Bone marrow edema appears bright within the dark bone. True or false? True again. When scanning a patient with any confounding MSK issues, it is always a good idea to do what before getting the patient off the table? A, call your best friend. B, go get coffee. C, call the ordering physician. Or D, call your radiologist. Please call your radiologist. Your patient is experiencing pain and swelling of the right hallux. What part of the body needs to be imaged? A, ankle. B, toe. C, finger. D, wrist. B, toe. When scanning a knee, proper positioning requires that you what degree rotate the foot, approximately what rotation to stretch the ACL. A, internally, 10 to 15 degrees. B, externally, 10 to 15 degrees. C, internally, 30 to 45 degrees. D, externally, 30 to 45 degrees. The answer is B. Externally, 10 to 15 degrees. This question was asked once, earlier in this video. You must know this information. Now let's learn the front parts of the foot. A, head of the third metatarsal. B, proximal phalanx. C, head of the fifth metatarsal. D, shaft of the metatarsal. E, base of the fifth metatarsal. F, cuboid bone. High yield. Must know. H is metatarsal phalangeal joint, MPJ. NG is head of the first metatarsal. This is the T2 weighted, long axis taken in the axial oblique plane of the foot. Your patient has a large red bump on the foot that you are supposed to scan. Which of the following should you always do before getting started? A. Call the ordering physician. B. Call your radiologist. C. Place a marker on the area of interest. D. Ignore the patient's problem. C. Place a marker on the area of interest. Usually, you use the vitamin E pill. Liposarcomas are one of the most common soft tissue sarcomas. True or false? True. What muscle is being referred to below? Large muscle posterior to the knee. Allows for plantar flex of the foot. Origin, lateral and medial condyles of the femur. Insertion, calcaneus by Achilles tendon. A. Peroneus longus. B. Vastus medialis. C. Tibialis anterior. D. Gastrocnemius. E. Quadriceps. The answer is D. Gastrocnemius. What anatomical structure are these descriptions referring to? Limits amount backward movement of tibia. Tightens as knee flexed. Stronger than its anterior counterpart. A. LCL. B. PCL. C. ACL. D. MCL. E. Meniscus? The answer is B. PCL, posterior cruciate ligament. When scanning a patient for a quadriceps tendon injury, where is the key anatomy? A. Anterior aspect of thigh. B. Posterior aspect of thigh. C. Posterior aspect of tibia. D. Anterior aspect of tibia. The answer is A. Anterior aspect of thigh. Let's learn some more anatomy. This is the last set of images. A's. Base of metatarsal. B. Navicular. C. Cuneiform. D. Head of metatarsal. E. Proximal interphalangeal joint. F. Distal interphalangeal joint. G. Distal phalanx. H. Middle phalanx. J. Proximal phalanx. A. Fibula. B. Calcaneus. C. Lateral malleolus. D. Tibiotalar, mortis, joint. E. Talus. F. Talofibular joint. G. Subtalar joint. H. Medial malleolus. This is the last one. J. Tibia. Femur and tibia, fibula studies are often referred to as long bone studies. True or false? True. What anatomical structure are these descriptions referring to? Provide stability to inner knee. More easily injured. Lateral stretching tearing ligament. May feel pop, pain, swell even buckle. A. ACL. B. LCL. C. MCL. D. PCL. E. Meniscus? The answer is C. MCL. The anterior tibial artery leads into the dorsalis pedis artery. True or false? True. That's it. You are done. I will post more questions to quiz you in different videos. Thank you for watching this. Please like, comment, share, and subscribe.